I have to be honest with you about something I should have said out loud a long time ago. I've been a practicing physician for over 2 decades, and what I'm about to share with you is the kind of conversation most doctors save for after clinic hours, if they have it at all. Because millions of people over 60 are doing something every single evening before bed, every single morning with their coffee, reaching into a pill organizer, swallowing something their doctor prescribed years ago, something they were told was completely safe and necessary. And here is what I have since discovered, and what the research now confirms without question. Some of those pills, the common ones, the familiar ones, the ones you trust, are actively working against the very stability your body is trying to maintain. The specific medical consequence I'm talking about is dizziness so disruptive it can pull the floor out from under you. Not someday, not eventually. Sometimes within the first hour of taking your morning dose. And what I want to do today, the real reason I made this video, is walk you through exactly which 4 categories of medication are most responsible and what you can actually do about it. And here is what I should have told my patients years ago, starting with this. The problem is bigger and quieter than most people realize. People over 60 who take daily medications for multiple chronic conditions are at real risk for over-medication and the complications that come with it. And one of the most common complications, the one that lands people in emergency rooms every single day, is dizziness that leads directly to a fall. We have become so focused on managing disease that we stopped asking whether the medicine itself might be contributing to something just as dangerous. I had a patient not long ago, a retired engineer, 63 years old, sharp as anyone I have ever met, who came to me after his second stumble in 6 months. He had not fallen badly enough to break anything yet, but the word yet sat in that room like a warning. He was convinced it was his balance getting worse with age. He was convinced his body was simply failing him the way bodies do. So what is actually happening when a person feels that spinning, unsteady sensation after taking their medication? Before I answer that, I need you to understand something about how the aging body processes drugs differently than it did 20 years ago. Most people imagine medication moving through the body the way water moves through a pipe. Same speed, same pressure, same result every time. But the reality is far more complex than that. Older adults are especially vulnerable because people's bodies absorb and respond to drugs differently with age. The kidneys filter more slowly. The liver metabolizes compounds at a reduced rate. Fat-to-muscle ratios shift. And all of that means that a dose that was calculated for a 50-year-old body can behave like an overdose in a 65-year-old one, even if the prescription has not changed by a single milligram. A person over the age of 60 may have a different body composition than a person who is 35 and may process medications differently. And when a drug stays in the system longer than it should, the side effects do not stay mild. They compound. They deepen. They turn a faint lightheadedness into genuine instability. And the terrifying part, the part my retired engineer had never been told, is that medications that cause dizziness or drugs that increase fall risk can be more dangerous when they are combined or taken at higher doses. He was on 3 of the medications I'm about to describe to you. 3. And nobody had ever sat him down and connected those dots. But that is not even the part that concerned me most. What comes next is, the part of this story that still bothers me is this. The research on this has existed for years, and yet it is rarely discussed in a standard 15-minute appointment. With increased medication use among the older adult population, adverse drug events and polypharmacy can be significant causes of dizziness in the elderly. Polypharmacy, which is basically what happens when multiple prescriptions start having a conversation with each other inside your body, and that conversation goes wrong, is not rare. According to a report from the U.S. Centers for Disease Control and Prevention, about a third of American adults in their 60s and 70s use 5 or more prescription drugs regularly. Think about that number. 1 in 3. And the more medications a person takes, the greater the biological chaos that can result. The more medicines a person takes, the higher the chance of over-medication, side effects, over-sedation, and other problems. Now, I had another patient, a woman, 68, retired school librarian, who told me she felt fine on each medication individually. It was only when we mapped out what she was actually taking together that the picture became alarming. She had what we call a prescription cascade building inside her regimen. A prescription cascade can occur when patients are prescribed medications to offset side effects caused by other drugs they are taking, compounding the risk of polypharmacy. One pill causing a symptom, another pill prescribed to fix that symptom, a third pill managing a side effect of the second. And somewhere in that cascade, her inner ear, The vestibular system, which is basically your body's internal gyroscope, constantly sending signals about where you are in space, was getting scrambled input from multiple directions at once. Side effects from these drugs can change the way a person feels or thinks and can cause drowsiness, loss of balance, changes in vision, slower reaction time, and other effects that increase the risk of falling. She told me she had just assumed it was normal aging. She had been dizzy for almost 2 years before she mentioned it. 2 years. There is a direct correlation between falls and mortality, morbidity, and reduced functionality. And the falls that dizziness causes are not gentle stumbles. They are the kind that fracture hips, crack wrists, and in too many cases permanently change the trajectory of a person's independence. What changed everything for me, and what should change everything for you, is the understanding that this is not inevitable. It is not just aging, and it is absolutely worth examining. I wish I had known this sooner, because the truth is, I was as guilty as any other physician of undercommunicating it. So let me walk you through the 4 specific pill categories that the research consistently flags as the most serious contributors to dizziness and falls in people over 60. The first is benzodiazepines. These are the anti-anxiety medications, drugs like Xanax, Valium, Ativan, medications that many people have been taking for years, sometimes decades, for sleep or anxiety or nerve pain. Benzodiazepines and other hypnosedatives are used to treat sleeping disorders and anxiety conditions. Benzodiazepines are the most common hypnosedatives, and other examples include the so-called Z drugs, Zolpidem, sold as Ambien, Esopiclone, sold as Lunesta, and Zaloplan. These medications slow your central nervous system, which is basically like turning down the volume on every signal your brain is trying to send to your muscles and your balance organs simultaneously. Medications like benzodiazepines can slow your thinking and reaction time, and they may also affect your balance and increase your chance of falls, especially if you take them regularly. And here's the part that stops me cold every single time. Benzodiazepines such as alprazolam, Xanax, and lorazepam, Ativan, have been linked in research suggesting that unsteadiness leading to falls as a side effect of this class of anti-anxiety medication may be connected to 1/3 of all hip fractures in people over 85 years of age. 1/3. The second pill category is blood pressure medications, specifically the ones that cause something called orthostatic hypotension. Medications that lower blood pressure are important for your heart health, but they can sometimes cause orthostatic hypotension, a sudden drop in blood pressure when you stand up, which can lead to dizziness or fainting. I had a patient, a 70-year-old man, former firefighter, proud of his fitness, who told me the room tilted every time he got up from his recliner. He thought it was just normal dizziness. It was his blood pressure medication doing exactly what it was designed to do, just doing it too well, too fast, for a body that needed more time to compensate. But that is not even the part that concerned me most. The third and fourth categories go even deeper. And what my research into this revealed next, I genuinely was not prepared for. The third medication category is antidepressants, and this one is harder to talk about because these are medications that genuinely help people, medications that address real and serious suffering. So I want to be careful and honest here. Some antidepressants, including selective serotonin reuptake inhibitors, SSRIs, and older tricyclic antidepressants, may cause dizziness, sedation, or drops in your blood pressure. SSRIs, which work by increasing serotonin availability in the brain, basically flooding the brain's messaging system with more of a chemical it uses to regulate mood, also affect the brain regions that control balance and coordination in ways that are only now being fully understood. You may notice these effects more when you are standing up or walking. The research has been tracking this pattern clearly. Fall risk increasing drug use prevalence at the time of fall-related injury ranged from 65 to 93%. Antidepressants and sedatives hypnotics were the most commonly prescribed drugs in that category. That number landed hard on me when I first read it. The fourth category is diabetes medications, specifically the ones designed to lower blood sugar. Insulin and some oral diabetes medications can lower blood sugar too much. Low blood sugar may cause shakiness, weakness, confusion, or fainting, which increases your fall risk. Hypoglycemia, which is basically your brain running out of its primary fuel, is one of the most underestimated dizziness triggers in older adults with diabetes. I worked with a woman, 66, a retired nurse who managed her diabetes meticulously, who was experiencing dizzy spells mid-morning that she could not explain. She was doing everything right, taking her medication exactly as prescribed. But as we dug deeper, we found her doses were calibrated to a body weight and activity level she no longer had. The medication was working too well for where her life actually was. Particular attention should be paid to patients who receive 4 or more medications and to those taking psychotropic medications, as these medications have specifically been linked to a strong chance of a future fall. And when you combine 2 or 3 of these 4 categories in the same person, which happens more often than you could imagine, the risk multiplies in ways that no single prescription label warns you about. There is one more piece of this story, and it changes everything. What I should have told my patients years ago, and what I want to tell you right now, is that none of this means you simply stop your medications. That is not the message. Please hear that clearly. These medications exist for real reasons, and stopping them without medical guidance can create dangers far greater than the ones we are discussing. What the science actually tells us is more actionable and more hopeful than that. Reviewing medications with all patients 65 and older is a starting point. The goal is to stop medications when possible, switch to safer alternatives, and reduce medications to the lowest effective dose. The first practical step I recommend to every patient I see is what I call a full medication audit, and it is simpler than it sounds. You sit down with every prescription bottle, every over-the-counter supplement, every sleep aid and antacid, and you bring that entire collection to your next doctor's appointment. Not just the prescriptions, everything. Non-prescribed drugs and products factor in too. Some herbal preparations and nutritional supplements are aggressively marketed to older adults with exaggerated claims and little scientific evidence to back them up. They can interact with prescription medicines and cause side effects. I had a patient, a 69-year-old woman who had been dizzy for months, who was taking a ginkgo biloba supplement she had seen advertised. Supplements made with ginkgo biloba may exaggerate the action of prescription blood thinners, putting a patient at risk for bleeding. Nobody had ever asked her about it. Nobody had ever connected it to her symptoms. The second practical step is to ask your doctor one specific question the next time you sit down together. For each medication I am currently taking, what would happen if we lowered the dose or tried a different class of drug entirely? That question alone has changed outcomes for patients I care for. A prescription review with a doctor at least once a year can reduce patients' use of prescriptions they no longer need and can help them avoid unnecessary side effects and interactions. The third step is timing. Many of the medications we have discussed today hit their peak concentration in the bloodstream within 1 to 2 hours of being taken. That is when dizziness risk is highest. So ask your pharmacist, not your doctor, your pharmacist, because pharmacists often know this better than anyone, whether the timing of your doses could be adjusted to reduce that peak risk during your most active hours. There is still more you can do, and it is where this story starts to genuinely shift towards something better. The practical second half of this is about what you can build alongside the medication conversation, not instead of it. The first thing the research consistently points to is physical movement, specifically the kind that targets your vestibular system and your proprioception, which is basically your body's internal GPS. The network of sensors in your muscles, joints, and feet that constantly tells your brain exactly where you are in space. Balance-focused exercises, specifically walking heel to toe and standing on one foot in combination with coordination exercises, are proposed for fall prevention. These are not complicated. They do not require a gym. They require about 10 minutes a day and a wall nearby for safety. I showed these to a patient of mine, a 64-year-old man who had been dizzy for months on his blood pressure regimen. And within 3 weeks, he described his confidence on stairs as fundamentally changed. The second thing worth knowing involves vitamin D. Vitamin D supplementation has been shown to significantly reduce fall risk, especially among older adults with low vitamin D levels, those who took at least 800 IU of vitamin D a day for longer than 6 months. Vitamin D, which functions less like a vitamin and more like a hormone, controlling muscle function, nerve transmission, and coordination throughout the entire body, is deficient in a staggering number of older adults, often silently. A simple blood test can confirm your levels, and the fix, when appropriate, is genuinely one of the lowest risk, highest reward interventions in all of senior medicine. The third thing is environmental. Walk through your home and look at it through new eyes. Where are the rugs that could catch a foot? Where is the lighting that goes dark between the bedroom and the bathroom at 2 in the morning, which is exactly when someone on a sleep medication is at their highest risk of a disorienting, dangerous fall? Drugs used to help you sleep can cause grogginess, confusion, or poor coordination the next day. They can also make nighttime trips to the bathroom risky, since you could lose your balance. If something in this video felt familiar, if you have ever been told by a doctor that your medication was completely safe, only to be experiencing dizziness you cannot fully explain, I want you to type the word SAME in the comments right now. because you are not alone in this. Not even close. And I want to know how many of you are sitting with this recognition right now. You just spent real time learning something that most people move through their entire lives without ever knowing. And I mean that with complete sincerity. The connection between your medication cabinet and the floor beneath your feet is not a fringe idea or a piece of health alarmism. It is documented, it is real, and it is something you now understand better than the majority of people who will never watch a video like this one. Let me give you the honest summary. The list of drugs that increase fall risk includes antidepressant drugs such as SSRIs and SNRIs, blood pressure drugs such as diuretics and calcium channel blockers, diabetes drugs such as insulin and glipizide, and benzodiazepines. These are not obscure medications. They are among the most commonly prescribed drugs in the world. And a review published in JAMA Internal Medicine looking at medication use before and after fractures among over 168,000 Medicare beneficiaries found that 3/4 of study participants had been taking at least one drug known to increase fall risk before the fracture occurred. Yet only 7% of those patients stopped taking the problematic drugs after the fracture. 7%. That number tells you everything about how normalized this risk has become, and how little it is being corrected even after something goes wrong. I made this video because I kept seeing the same pattern in my practice, in the research I read, and honestly in people I care about personally. People who are thoughtful, responsible, and genuinely working hard to stay healthy, and who had no idea their pill organizer was working against them in this specific, measurable way. The solution is not fear. It is information. And the next step is a real, honest conversation with your physician and your pharmacist. Not a panicked one, but an informed one. Come in with your full medication list. Ask the timing questions. Ask the dose questions. Ask what alternatives exist. Nurses, pharmacists, and providers all play a role in identifying medications associated with increased fall risk, educating patients on the risks and benefits, and working together to stop, switch, or reduce the doses of medications associated with falls. You are allowed to ask those questions. You are allowed to expect real answers. I want you healthy. Not just surviving, actually healthy, actually steady on your feet, actually confident in your own home. And that matters to me more than I can really explain in a YouTube video. If something in this conversation